Hello students, welcome to my channel Pharmacology Made Easy by Rashmi Mudliar. Now we will start with the third topic, and that is the third chapter in majority of the syllabus, that is respiratory system. So with the name itself it is clear, respiratory means respirate, or you can say breathing. So when we talk about this topic, it is more related with the complications that come with the respiratory system. So respiratory system is related to the lungs. Lungs are responsible for breathing. But if at all some breathing difficulties are there, those difficulties can be tackled in this chapter, that is the drugs acting on respiratory disorders or respiratory pharmacology. So in this topic we are going to discuss two major things. First is anti-asthmatic drugs, and the second one is pharmacotherapy for cough. We'll start with the first topic. You can say the anti-asthmatic drugs or drugs used in bronchial asthma. You must be knowing bronchial asthma is a kind of a hypersensitivity disorders. It is a kind of allergic response what the body shows in a very frequent manner. Usually normal cough and cold happens to all of us 3 or 4 times in a year, but that is not considered as asthma. But some people, every weather change, any change in the food habits, any emotional trauma, they will frequently suffer with breathlessness, and that condition is called as the bronchial asthma. It is a kind of a hypersensitivity disorders, and in this usually the breathlessness is a common complication. It is hereditary also. It is having the sensory and psychological stimulus also, and when person suffers with bronchial asthma, there used to be attacks, frequent attacks used to be there on a regular interval, and this condition is called as bronchial asthma. In this bronchial asthma, usually the people will have more and more hypersensitivity reaction, and because of that person feels this kind of a breathlessness symptoms. This can be very well tackled by the major drug, that is salbutamol. So we are going to discuss majorly about the anti-asthmatic drugs salbutamol in the description. So salbutamol is a drug that can be used in the form of respules, that is used in the nebulizer. We can use it as a tablet, capsule, syrup, injection, and one of the very important drug that we are using in the form of puff or inhalers also. So this drug usually controls the hypersensitivity reaction. It will act as bronchodilator, immediate bronchodilator. So this drug immediately dilate the bronchiole, and because of that person find it very comfortable while breathing. Otherwise the person would be struggling with the breathing, and as soon as the puff will be taken, usually it is available with the brand name Asthalin. So Asthalin puff, when person takes only 2 puff, that is a metered dose, when the person takes, immediately person feels relaxed and person will be able to breathe comfortably, and that's why it is a life-saving measures for many of the people who are suffering with asthma. So all these the salbutamol drug we will do in detail while discussing the anti-asthmatic drug in detail. Now we will discuss the second major parameter here, that is pharmacotherapy for cough. This is the second major parameter. In this we are going to discuss like why cough happens and what goes wrong when cough happens. Cough is a protective reflex. As such, coughing is good because any unwanted particle, it can be dust, it can be food, any allergen, your own saliva, microorganism, majorly bacteria, virus, fungi, when they will try to enter into your respiratory system, and via it when they are trying to settle themselves in the lungs, it is a system, the body will show it in a form of reflex action or as a response. So that coughing is a sudden opening of glottis that will allow all the unwanted particles to go expel out of the body. So to expel any unwanted foreign particle out of your airway is coughing. So coughing is a protective reflex where previously closed glottis suddenly open with a blow, and with this blow of air, all the unwanted particle, foreign particle, microorganism, anything that has entered into the closed glottis will be expelled out of the body, and that is coughing reflex. So coughing is very good as such because it's a protective reflex. But sometimes this sputum that gets generated while coughing itself is a problem. So for that situation we need to understand the pharmacotherapy for cough. Pharmacotherapy of cough means how to tackle the cough in a better manner. There are 5 major medicines we will discuss that will tackle the cough. First thing is going to be bronchodilator. Bronchodilators are the drugs that will dilate the bronchiole. With the name itself it is clear. The drugs that dilates the bronchiole so that the extra airway that is created, that will help you to breathe comfortably and easily. The drug is mucolytic. With the name itself it is clear. Muco means mucus, lytic means breakdown. So the drugs that break down the thick viscid mucus into a more fluidy one, so that with the normal cough reflexes this sputum can be expelled outside, is called as the second one, that is mucolytic. So lysing the mucus, the thick viscid mucus will be broken down into small pieces that will be easily expelled out of the body with the normal cough reflexes. Number 3 is going to be decongestant. Sometimes when we are having severe cough and we go to the doctor will say there is a severe congestion. Congestion means water sound when you are hearing it with the stethoscope. So it is more like fluid deposition into the pleural cavity, and because of that the person's lungs will have the sustained pressure, and this condition can be very well tackled with decongestant. Decongestants are taken for the lungs also, they can be taken for the nose also. Sometimes nasal drops or nasal sprays will be put inside the nose or in the nose, so that the person will feel very comfortable while sleeping. Usually when we lie down, it's very difficult to breathe when you are having cough and cold, and you will feel that there is a choked nose or blocked nose, and that makes the sleeping experience very worse. So in this situation usually decongestants are used. These are the nasal drop or nasal sprays. When they will go into the nostrils, they will reduce down the swelling in the respiratory tract, and because of that air channel will be created and person will be breathing comfortably while sleeping. They are decongestant. Number 4 is going to be expectorant. Expectorant word is coming with the word expelling. When the person is having the wet cough or productive cough, this cough has to expel out of the body, because this is a useful cough. Whenever you are coughing, sputum is coming out. So we are removing all the unwanted microorganism, dust particle, any foreign body from the body or allergic response of our body. So what we are doing, when we are expelling this cough, it is good for us, and that's why it is called as useful cough or productive cough. Why is it productive? Because every time when you are coughing, some sputum is getting produced, and it's good to remove this unwanted sputum out of the body. So in this situation, the agents what we are using, they are called as the expectorant. Expectorant cough syrups are available into the market, and they are sold with the brand name, with the description for wet cough, or they are also called as expectorant. Expectorant is a medical term. General words, in a general way, it is called as the cough syrup for wet cough. The last category is antitussive. Anti means against, tussive means cough reflexes. There are some medicines that reduces down the cough. Why is it? Because the cough is not a productive cough, it is a useless cough. Means whenever you are coughing, no sputum is coming out, and it is just disturbing your sleep, and that's why it is called as useless cough. Usually it happens in old age. As the age progresses, there is a degenerative changes, and because of that person will feel a lot of dryness in the throat, and when there is a dryness in the throat, again and again cough reflexes gets activated, and body will try to produce the cough response. But because these cough reflexes are not producing any cough, because there is no infection, there is no sputum production, so this cough is useless cough. And when in the night, when it goes even more worse, it disturbs the sleep of the patient as well as the people sleeping around. So in this condition, antitussives are given. Anti means against, tussives means cough reflexes. These medicines will calm down the coughing reflexes, and person will be able to sleep comfortably without disturbing himself as well as the other people around. So for these purposes we are using antitussive drugs. So these are the 5 major things that are there in the pharmacotherapy for cough. First is the bronchodilators, decongestant, mucolytics, expectorant and the antitussive. So these are the major things that are part in the respiratory system. So in this first video we have covered the major things that are related to respiratory system. So thank you for watching, and we'll see you in the next video. Thank you so much.